Hello everyone, my name is Tyson Pillow. I'm in the Department of Emergency Medicine.
I'm Stacy Rose. I'm a faculty member here at Baylor College of Medicine, and I practice internal medicine, infectious diseases.
Today we're going to be talking about common terms that doctors say that you may hear in the hospital or on your favorite TV show.
Bypass. This is when you have to get around a blockage. Coronary bypass, for example, means connecting two arteries of the heart so that you can get around a blockage.
Start a central line. So it's in quotation, so you have to say it really forcefully, and it really helps to point at someone and then cross your arms and look really important. But starting a central line means to start a access in a large vessel. So normally when you go to the hospital, you might put a line in your arm, and those are really small catheters. A central line is a much larger, longer catheter and may go in your neck, in your chest, or even in your groin.
A laceration is just a cut, such as on the skin. A lesion is a catch-all term ranging from anything from a pimple to a cancerous. It's anything that's not normal.
So code blue is a very common term used in a lot of facilities to mean that the patient's in distress. So if you hear overhead at code blue, a designated team runs over to that patient, wherever they may be, to make sure to take care of the patient, perform CPR, help them breathe, or do whatever they need.
A suture is just a stitch, such as when you have a cut or after surgery. A hematoma is doctor's term for bruise.
NSAID is how this is pronounced. NSAID, non-steroidal anti-inflammatory drug. So this is actually just some of your common pain medicines like ibuprofen or Motrin. So you probably use these pretty commonly, and the formal term for them is NSAID.
Anything that ends in itis means that it's inflamed. So when you hear hepatitis, it means that the liver is inflamed.
I actually get to say it sometimes in the emergency department. So this is epinephrine is the epi that we're talking about. And so if we need to restart someone's heart, or if we're dealing with an allergic reaction, then we may call for epinephrine. So you get to say push one of epi.
Malignant means cancerous. Benign is the opposite of malignant. You'd be much more happy if you heard that your tumor was benign.
Remission. So this is one of the good words you want to hear. So this means that something, usually cancer, has been treated successfully and the doctors can no longer find any evidence of it. So your disease is in remission.
HDL and LDL. These are both types of cholesterol. The H stands for high density and the L stands for low density lipoprotein. What you need to know is that HDL is good cholesterol that you want to be high, and LDL is bad cholesterol that you want to be low. And that's all we have for you.